Hello everybody, welcome to UroChannel. I get this question all the time. How does normal semen look like? Just the other day, a patient came into my office and was very concerned with what he described as jelly-like lumps he had observed in his ejaculate. And there are other questions. What if it is yellow, and how much is the right amount? Is more better? I will answer all of these questions and more in this video. As a urologist who is doing a fair amount of sperm analyses, scrutinizing ejaculate is part of my job. So I not only know how it looks like, but also, like a perfumer, I also assess the smell of the ejaculate to find out about any abnormalities. Many of you might be wondering how I would get all these samples. In Germany, men with either fertility issues or who are concerned about their fertility go to a urologist or a fertility clinic to get their semen examined. The sample is produced by masturbation in a special room in the office after 3 to 5 days of sexual abstinence. The reason for this is temperature. If the patients live close by, they may do this at home, but in order to assess certain sperm characteristics, I would like to have control over the temperature, because if the sample gets cold, the sperm cells will become slower, for example. In my office, I have the means to keep them at 37 degrees Celsius until they are ready for analysis. Semen volume is measured by weighing the sample. I know many of you will be disappointed now when I tell you the normal amount of semen. It is 1.5 to 5 milliliters. There are a number of variables with influence on semen volume. It tends to be largest in a man's 30s and decreases with age. The timing between ejaculations is important too. Seminal fluid is more or less produced in the seminal vesicles and prostate exclusively, not in the testicles as many believe. After ejaculation, the body will have to fill up the reservoirs again, which takes time, meaning that having ejaculation several times a day will lead to smaller amounts of semen, simply because the body didn't have enough time for production. And vice versa. Long periods of abstinence usually lead to larger amounts of ejaculate. Many men wish to have more amount of semen volume as can be observed in porn movies. However, porn is not reality, and larger amounts of ejaculate may have negative consequences for fertility. This is because of dilution. As you might remember, sperm cells are produced in the testicles. The fluid itself stems from the prostate and seminal vesicles. So let's assume 100 million sperm cells are ejaculated. It makes a difference if this is 100 million in 10 milliliters of fluid or 2 milliliters of fluid, because the concentration per milliliter will decrease the more fluid there is. Since sperm concentration per milliliter is an important parameter for fertility, higher amounts of ejaculate may become problematic. The lower threshold for being fertile is 15 million per milliliter, by the way. Excessive amounts of ejaculate are called hyperspermia. They may be an expression of an inflammatory process in the seminal vesicles. The highest amount on record I found in the literature was 13.0 milliliters, by the way. Hydration plays a role as well. If you don't drink enough, the amount of ejaculate might even diminish. And in these cases, it might even have a thicker, more clotty consistency. It is very important to know that immediately after ejaculation, it is typically jelly-like, and that's totally normal. It takes 15 to 30 minutes for semen to liquefy, but even then, there might be some jelly-like clots left, and that's totally okay. The color of normal ejaculate may vary a bit. Normally, it has a creamy, gray, opalescent appearance. After long periods of abstinence, it might also be a bit yellowish. If it is brown or red, it means that there is some blood. If you're interested to know what blood in the semen means, click on this link. Thanks for watching. Bye-bye.